Welcome to our channel Examine the BDS. Today we are going to see about gingival enlargement. In a healthy adult, gingival tissues are present in the interproximal spaces between the teeth. The enlargement of gingiva may be localized to one papilla or may be spread throughout the mouth. It can be classified based on etiological factors. Let's now look upon them one by one. First, let us see inflammatory enlargement. Here the enlargement results because of local irritation such as poor oral hygiene, accumulation of dental calculus or mouth breathing, and it represents host tissue response to dental plaque accumulation. Here the gingiva is soft, edematous and sensitive to touch, and it can easily bleed. It looks glossy and non-stippled. Now let's see drug-induced gingival enlargement. There are mainly three sets of drugs that cause it: anticonvulsants, immunosuppressants, and calcium channel blockers. Here it is a result of proliferation of fibroblasts and decrease in the collagen degradation. Drugs that are involved are ethatoine, mefenitoine, valproic acid, and immunosuppressants like cyclosporin, and calcium channel blockers like nifedipine, verapamil, and amlodipine. Here the gingiva is increasingly stippled and looks rough and pebbled. Sometimes it may be so severe as to interfere with everyday functions. For this reason, it may be surgically excised. Unfortunately, its recurrence is common, but maintaining a good oral hygiene will result in a slower development of the enlargement. Now let us see hormonal enlargement. Inflammatory gingival enlargement often occurs at puberty both in men and women. This may be the result of endocrine imbalance at this particular stage. And in pregnancy, increased levels of estrogen and progesterone cause change in the vascular permeability, which leads to gingival edema and altered inflammatory response to dental plaque. It may also be called as pregnancy gingivitis, and at times it is so severe that it is referred to as pregnancy tumor. Now we'll move on to nutritional enlargement. Here the deficiency of vitamin C causes the enlargement of the gums. Here we can find spongy and bleeding gums. They bleed upon the slightest provocation, and the sulci are often filled with partially clotted blood. The gingiva is spotted frequently with hemorrhages, ulceration, and necrosis. The treatment involves maintenance of good oral hygiene and administration of vitamin C. Now let's see the last etiological factor, that is allergic enlargement. Plasma cell gingivitis. Plasma cell gingivitis usually arises as a hypersensitive reaction to a component of chewing gum, dentifrices, or some of the dietary components. It presents itself as a mild marginal gingival enlargement. Clinically, the patient complains of soreness in mouth, and which is intensified on taking hot and spicy food. Here the gingiva appears atrophied, dry, and exhibits cracks and fissures. Treatment involves the careful study of patient's history and elimination of the possible allergens. We can prescribe topical and systemic steroids for the alleviation of the symptoms. This topic ends here. Let's see today's bonus fact. Your eye blinks 20 times a minute. That's over 10 million times a year. Kindly share and subscribe our channel. Thanks for watching.